Hello everyone, welcome back to Easy Nursing. I'm going to explain about how to do blood transfusion. So blood transfusion is basically a procedure one we do when patients are low in blood. So there is a patient called John Smith who has a GI bleeding because of peptic ulcer. He has this episode of bleeding that he's facing, and he's losing a lot of blood. And I have to give the blood transfusion to this guy. So this is in my OSCE, and I'm just gonna explain what I have understand from this thoroughly. All right. So this guy John Smith. So he's 68 years old, male, of course. Um, so what are the things that we need? Because there are 5 documents that you need before you start the procedure, right? You're gonna need you're gonna need this blood pack information, where all the information about blood, like what's the you know expiration date, what's the donor number, what's the red blood cell, like what is it. You have to check that first, and once you're done with that, you're gonna check with the IV order, like how much blood are you giving. I'm giving 1 unit for 4 hours. That says it all here as well. And the third one is IVT. So IVT explains the cannula. Like the cannula is patent. If the cannula is not patent, if we have to recite it, then that's a different scenario for him, right? So we have to also mention that as well, that we are checking the cannula, assessing the cannula. If there is any redness, swelling, that we are not considering doing that. We're gonna inform the RN or the doctor to check that. We have the medication chart to check the details, MRI number, and if there is any allergies the patient have. So this is the fourth document we need, and the last but not the least, the consent form, where we're gonna talk with the patient about, did you sign this consent form yourself? That's where it comes with right to refuse, right? We are doing 11 rights. So we can explain about, we are doing this procedure with you, is that okay, are you happy with the procedure, right? So how will this play out, right? So before doing, so for example, if John is in the room and I am outside and I'm doing the whole procedure as an EN, then I will, under RN supervision, then I'll just go to the room, and then, hi John, my name is Hansel, I'm gonna be your EN for today. How are you today? Good. Can I have your full name, please? And date of birth and MRI number. Okay. Is it okay if I check your MRI number on your wrist? So I'm gonna check the MRI number, and I'm gonna just ask, can you tell me, if do you have any allergies, right? Cool. So I'm not just getting his oral, but I'm gonna go on the bedside and I'm gonna check if the things that he's saying is right or not, using the medication chart. So I'm gonna check, yeah, John Smith, right, and I'm gonna check the MRI number on his hand using this one, penicillin. Okay, he said that he's penicillin. Cool. So I'm just verifying that everything that he's saying is right. Once I verify, I'm going to tell him, so John, it's going to take, so I'm going to do blood transfusion today. It's going to take 4 hours. If you want to go to the washroom, I'm going to tell the reason why we're doing that GI bleeding, as he's aware of that. And also I'm going to, at the same time, I'm going to tell him that, is this the blood transfusion consent form that you signed? Is this your signature? Do you want to do it? I'm just going to verify that, because he has the right to refuse, and if you don't want to do it in the last moment, it's fine. And I'm gonna tell them, and he's happy and aware of that, so we're gonna proceed with that. So John, I'm gonna be back with my equipment, and till then, I'll be back in like 10 or 15 minutes. Just tell him, and then come back out of the room. And once that's done, what you're gonna do is, you're gonna you know um take your stuff. Like, you have 5 documents ready, you have your, so you need one blood, you need one saline on side, you need the IV tubing, and you need 2 alcohol swab, you need 10 ml syringe with drawing up needle to flush. You have to flush it before putting the cannula, so you have to flush it, and you need the label to label it down, and you need 2 IV tag to write it down, when did you start it on 2 IV, and that's pretty much it. You need those equipments, and you need your hand hygiene gloves, that's for sure. So once you have these items, then you can literally go to the room, and then so when you are taking things out of the drawer, like the blood and whatever that is, you're gonna check with the every documents, like, is that the blood group is right, the O positive, is the expiration date right, the blood donor number, the expiry date, everything that is there. You're gonna check it, you're gonna cross check it to make sure that you are doing the right thing. And once you are ready to do that, you're gonna make sure that whatever you are doing, whatever you are putting yourself into, is you are doing the right thing, like checking every documents again and again. That's all, that is all about this nursing. And once that's done, that's the first check that you are doing with yourself, and then you're gonna call your RN and you're gonna tell. So and also at the same time you're gonna do 11 rights. So right patient, right drug, right medication, right expiration date, right refuse that patient said he's okay to do, right response, right documentation, right form, right time, right route is through IV, right? So we know that all. So after we know that all, we're gonna call our second nurse to check whether the thing that we are doing is right or wrong. So we're gonna so the nurse will gonna come up, she's gonna check the blood group, she gonna also we're gonna, you know, and we're gonna differentiate between, like, okay, this is the blood group we are doing, the donor number is, that's what it written in the pack as well. And we're gonna check everything again and again with the nurse as well throughout the procedure. And once the nurse verify, okay, cool, this is the right one, you're gonna give this, okay, this is fine, you can proceed. So once that done, we're gonna go with nurse in the patient's bedside. Again, we're gonna do the 11 rights. We're gonna, okay, check again, we're gonna like put this in the pole, the IV pole, and we're gonna check again, right, the documents that the product that we're giving is right. So that's the whole procedure, right? So that's the third check. So once the third check is done, and we're gonna start the procedure. So before doing that, the flush is ready, right? You have done the flush, the nurse said that the flush is ready, she's happy to give it. So you're gonna assess the cannula. Is the cannula is patent or need to be decided? Is there any swollen? You're gonna take your IV VIP chart, which is like um, visual infusion phlebitis score. So if it should be 0 or 1. If it's 0, that's perfect, but if it's 2 or 3, then you can't do it, you have to decide the cannula. So you're gonna check the cannula first, and then after that you're gonna you can literally flush that cannula. So once you flush that, because you wipe it down, and after that you're gonna start, you know, arranging how to give the blood. So you're gonna make it ready, the bag, you can make bag ready, put 2 labels on to make sure that you can write what time you started. So the label I'm talking about is this label. Who is the label? All right, here. So the label I'm talking about, it's a small label. I feel like I do have it. I did have one of those, but so this is what I'm talking about. To write it down what time I started. So you're gonna put in one saline in one blood, and after that what you're gonna do is so you're gonna prime it. So before putting in the machine, you're gonna prime it. That is very important, right? So you're gonna prime the cannula, you're gonna prime the blood, and once you're gonna prime it, like clamping and things like that, there are a lot of things that you have to do along the way. But once the blood is on the end of the thing, then you're gonna put in the machine, right? So then you're gonna put in the machine, and then after that you're gonna basically, so also make sure that you are not there isn't any bubbles that you are giving to the patient. Try to escape it by, you know, making it like a string, and flush the cannula. So just before doing that, flush the cannula, as you have already rubbed the hub for 15 seconds. And well, I said it earlier, but try to do it just before doing the transfusion, right? So after flush it, you're gonna inject the thing. You already put the thing in the machine, and it's ready to go. So once it's ready to go, then what you have to do is, like, you're gonna put the score, like volume to be infused, let's say 250 ml of blood is going to give the patient is going to get. So 250 and 250 divided by, we are giving for 4 hours, so it will be 62.5. that means it's 63. We're gonna round it up because it's very hard for the machine to interpret. So after that, you're gonna start the thing, and if that thing still make noises, then that means that there is some sort of problem that you did not discover, or there is a problem, or the machine will give you a prompt about what is the problem. If there is a bubble, they will call like there is bubble, or if there is anything anywhere clamped, the blood is not coming, then it will say the same thing as well. So you have to be careful about there shouldn't be any blood, and you have to give the floss, because that's where many people make mistakes, right? Don't give any blood, like try to take out, maybe try to take out the blood, and try to string it up. And once you are done with that, pretty much that's the whole case, that's the whole thing you gotta do. Because after that you have to consider it. So after that, the blood is going for 15 minutes. You're going to stay with the patient for 15 minutes. Don't leave the patient, because that's where the reaction might happen. That's like the rashes or allergic reaction that might happen. So also check the vital minutes just after 15 minutes to check the baseline, that the baseline that you took just before starting is right or wrong. If there is changes, you have to call the patient, sorry, you have to call the doctor or the nurse, the RN, and that's pretty much it. And the 4 hour will go anyway. And once you are done with that, you're gonna put that blood thing in the other one. So you're gonna clamp the blood because the blood is finished, and then you're gonna open the saline ones, right? The rate is same for saline as well, depending on the volume of the saline. And if that's same volume, then divide by 4 as same as it. And documentation, you have to write it down, like what product number is it, like all the things here, like time collected, time started, what time you started. So in this, it's better if you write it down for the documentation. And if there is an abnormality, let the RN know about it. The RN will resolve it for you. And that's pretty much it for blood transfusion. It's just that it's more of a skill than talking, but if you know what you are doing, if you know the theory in proper, just like I do, right? I know everything about it. Then it's easier, because it's just about doing. Because if I can say about things, if I can literally, I know every step what I need to do, if I know every documents, every equipment, what I need to do step by step in my mind, then I can literally perform it as well, right? There shouldn't be any problem. And yeah, that's pretty much it. So try to get into the basic first, like what I'm doing, why I giving the anemia, it's giving for anemia. You need to know the fundamentals first, and if you know the fundamentals first, life becomes so much easier, right? That rather than ranting about stuff. And that's pretty much it. So thank you for watching the video, and make sure to hit the subscribe button to get new updates in for more videos like this. I'm gonna make a couple of videos on maybe on this semester that I'm doing right now. And stay tuned. Thank you very much.